I said to him, we simply could not have done it without you. And I say to each and every one of you and to the American Public Health Association, we simply could not have done it without you. There was a time, now this is still not part of my remarks because I've learned of this, I don't know if this is coming out of my time, but I want to express my appreciation to you. There was a time in the course of the debate on the legislation, say when the election was lost in Massachusetts and the rest, when the press came to me and said, how are you going to pass this bill? How on earth are you going? Nobody believes you're going to pass this bill. And some of you have heard me say before, I said to them, we are not going to miss the opportunity of a generation to have health care for all Americans as a right, not just a privilege for a few. We believe we will stand there with Medicare, Social Security, now affordable health care as a pillar of health and economic security for our people and for our country. So not wanting to miss this opportunity, we will go up to any fence that stands in our way and push open the gate. If the gate doesn't open, we will climb the fence. If the fence is too high, we'll pole vault in. And if that doesn't work, we're going to parachute in, but we're not letting anything stand in the way for affordable health care for all Americans. So after it was over, the press came and said, which one did you do? So I said, well, actually, we pushed open the gate. We, 220 members strong, went up to that gate and pushed it open. And we were successful because we were not alone. All of you were there with us, with your ideas, with Dr. Benjamin's participation at the table with us, with your ideas, with your sense of urgency that this needed to be done, for the work that you do on the front lines in public health for Americans. You were there with us in helping to get the people to Congress who believed, as we believe, that this needed to be done. So when we pushed open that gate, you were there right with us. We felt your strength, your urgency, your dedication, and I hope you take some sense of satisfaction in your own participation in passing the bill. As I said to President Obama, I say to you, we simply could not have done it without you. Thank you, American Public Health Association. I am pleased to be here, and I know that you will shortly be hearing from Dr. Barbara Garcia, our Director of Public Health in San Francisco. We're very proud of her. We're proud of our Mayor, Mayor Lee. We're proud of our former mayor, now Lieutenant Governor Gavin Newsom, who are all part of our Healthy San Francisco agenda. And in that spirit, we welcome you to all the attendees of the 140th, wow, annual meeting. It's a privilege to welcome you to San Francisco, a city committed to improving the health of every patient, every family, where in healthcare, innovation, economic progress, we take pride in leading the way. We believe here that the health care for the most privileged person, the wealthiest, most privileged person in America, is better if every single person in America is in the loop, has access to quality health care. We're all in this together. And of course, our interest is at that level. The men and women of APHA, you all work every day to uphold the cornerstones of this organization's mission: protect, prevent, live well. Live well. As doctors, nurses, academics, social workers, and mental health professionals, you work to protect patients from harm, prevent illness and disease, and provide care to Americans so that they can live well. Meeting these goals means focusing not only on one case at a time, it means addressing the theme of today's gathering, prevention and wellness across the lifespan. And I understand that Dr. David Sanger is here, former head of the CDC, who has dedicated his life to all of that. Dr. Sanger, thank you. Dr. Sacker, thank you for being with us. Where's Dr. Sacker? I don't know where he is. Dr. Sacker is a hero to so many of us. Ensuring the well-being of Americans from childhood through their, what I'm in now, golden years, is the measure of your success and our country's success, and it is the core objective of two threads of our country's social compact, the Affordable Care Act and Medicare and Medicaid. When we enacted the health care reform bill with the partnership of the APHA, once again, Dr. Benjamin, thank you, our aim was clear: to secure quality, affordable care for every American. That's a long goal for us to reach. We put health decisions in the hands of patients and doctors and the community, not necessarily insurance companies. It was about following your passion for what you wanted to do in life, your passion, your talent, not your insurance policy. So ending people being job locked because a child had a pre-existing medical condition, or that any diagnosis, phone call, accident could determine the economic survival of a family. We heard your call. Dr. Benjamin wrote to us, and these were his words: to move from a system that focuses on treating the sick to one that focuses on keeping people healthy. And we acted to move from a disease care system to a health care system. It was more about the health of America, healthy America, as we have healthy San Francisco, than just health care, as important as that is. Central to the effort was prevention and wellness across the lifespan, and I was very pleased to hear Dr. Tuckson say how important prevention was. I was also pleased to hear him talk about the challenges we face with electronic medical records, how important it is for that to work correctly. And that's why we passed in the Recovery Act, more than 1 year before the Affordable Care Act, we passed billions of dollars of investment in the electronic medical records, information technology, so it would be ready when the health care bill passed. And of course, more needs to be done. But that is very important, because if we were starting from scratch, if we had no health care system, we would be starting with you. We'd be starting with community health centers. We'd be talking